It's time to take the pills. Most children hate swallowing medicine, and brother and sister Aaron and Yasmin Bueno are no exception. But their older brother has tuberculosis, a highly infectious lung disease. And after Aaron and Yasmin complete a 6-month course of preventative drugs, it will reduce their chances of contracting the disease. It's local volunteer Delia Lunasco's job to make sure they stick to the treatment. Delia says she knows the community and likes helping her neighbours. She's part of a new approach to tackling tuberculosis, bringing the care to the patients in deprived neighbourhoods like Caraballo, a TB hotspot. Doctors say no one should die from tuberculosis in the 21st century, but making that a reality in Lima is still a challenge. Hundreds of thousands of people still live in poor and overcrowded conditions, and the treatment for TB is long and expensive. The good news is Peru has the highest global recovery rate for multi-drug resistant tuberculosis at 83%. and extensively drug-resistant tuberculosis at 60%. The bad news is that it remains the Latin American country with the highest incidence of the disease per capita, and overall reduction is slow. US-based global health group Partners in Health is aggressively tackling the most resistant strains of the disease through a program called Zero TB.
The
plan for Zero TB is search, treat, and prevent. We go to the homes of every patient and make sure they don't abandon the treatment and ensure that all their contacts take the preventative medicine.
Treating the disease, especially the multi-drug resistant type, is expensive and arduous. The treatment is a mix of antibiotics and injections that can take up to 2 years to complete. Even with difficult cases like Francisco Verástegui, an HIV-positive former drug user, the aim is no deaths and no abandonment of treatment. Verástegui, who says he lost everything to his addiction to drugs, lives in a homeless shelter outside the city.
God has given me the hope to keep going, even though I've abandoned the treatment on several occasions in the past, but I didn't die, so I know that God must have a purpose for my life.
A quick and accurate diagnosis is key to controlling the spread of the disease. So Partners in Health built this state-of-the-art TB laboratory in an old shipping container, right in the heart of this deprived community. The only of its kind in Latin America, this lab can make 25 diagnoses a day, a big boost for Peru's strained healthcare services.
The diagnosis is very important because the patient often doesn't know what's wrong with them. Any delay can impact negatively on the speedy treatment, which the doctor has to give in each case.
What's working is walking the patients like Julia Roque through the lengthy treatment for multi-drug resistant TB, which she caught in hospital while being treated for diabetes.
To recover, you have to be determined, strong, and have plenty of willpower. Otherwise, you won't get better. If you quit the treatment, then only God will gather you up.
Peru is showing that constant moral support on the long road to recovery is making the difference between life and death. Dan Collyns, Lima.